Hello, I'm Dr. Ortiz from the Rubino OBGYN group, and I'm here today for another segment of Ask Your Doctors. When women come in for their annual exam and I ask them about contraception, they assume that I'm just talking about birth control pills. But I'm here today to tell you about all your contraceptive options and the different methods of getting contraception. The first is Nuvaring, which is a flexible ring that gets placed into the vagina that stays in for 3 weeks. You take it out for 7 days, you'll get your period, and you put a new one in. It's a little bit easier than pills in that it's something that you don't have to think about every day, but you still do have to remember to take it in and out. The next option is Depo-Provera, which is an injection in the arm every 3 months. Sometimes people can have some abnormal bleeding to start, but after a few injections, generally people have short, light periods to no period at all. And that could be helpful for girls with heavy, painful periods. Now, my favorite options are the long-acting reversible contraceptive options, or LARCs, if you've heard of that before. That includes IUDs and implants. I'm going to first talk about the IUDs. There are hormonal and non-hormonal options. The non-hormonal option is the Paragard or copper T. The IUD is a T-shaped device that gets placed in the top of the uterus. The Paragard IUD can stay there for up to 10 years. Now, you would get your period like you normally do every month. It just kind of creates a toxic environment for sperm in the uterus. To prevent pregnancy. Now, it has the potential to make periods a little bit heavier or maybe with some more cramping. So not my favorite option for women that have already heavy, painful periods, but it doesn't necessarily happen for everyone, so a great option for women who do not want hormones. The next option is the IUD with hormones, and there are a few different options with a few different doses, but they generally all work the same. These can stay in usually up to 5 years. They usually make your periods shorter, lighter, less painful, and again, you could potentially not get your period at all, and this is normal. The last option is the implant, or Nexplanon. This is a small rod, about the size of a matchstick, that gets placed here in the inside of the arm. You can't see it, but you can feel it. This also helps to make short, light periods, potentially no periods. The only thing people may complain about is some irregular bleeding or spotting here and there. In terms of effectiveness, the IUD and the implant are the most effective, over 99% effective. The other options that I spoke about in terms of pills, Nuvaring, and Depo-Provera are anywhere from 91 to 94% effective, and that's really with typical use. With perfect use, they can definitely be up to 99% effective. For more Ask Your Doctor videos, visit our ROG YouTube channel or our Facebook page.